Dr. Heidi Schwartzwald, thank you so much for joining our show today.
Thank you for having me. I'm pleased to be here.
No problem, no problem. So when we talk about developing diabetes, who is at a greater risk?
Surprisingly, those who are newly diagnosed with diabetes tend to be between the ages of 45 and 64. If you're Hispanic or African American, you have up to a 60% higher chance of being diagnosed. But there are many things that you control that put you at risk for diabetes as well, such as your weight, the food choices you make, and the amount of exercise you get.
And so what steps should we be taking in order to prevent and even manage diabetes?
There are a lot of things that you can do that are fairly simple. A small decrease in your weight, up to 5 or 10%, some healthier food choices, reducing sugar, and getting some more exercise, up to 150 minutes across the course of a week. These things alone can reduce your risk by greater than 50%. Of course, you also want to know your numbers, know what your blood pressure is, your weight, your cholesterol, and of course your glucose or your sugar.
Yeah, and knowing your numbers reminds me of getting screened. So when and even how should we start getting screened for diabetes?
The American Diabetes Association actually recommends you start your screening as early as age 35, especially if you have some of those risk factors that we talked about. Signify Health will do an in-home health evaluation at no cost to you, where we'll bring that screening right to your home, and our clinicians will spend some time with you talking about what are some of the goals you want to set for helping to prevent diabetes.
Yeah, that's awesome. So like you said, and there is an in-home health evaluation with Signify Health, but how could we book for that?
There are a couple of different ways you can book. Going to the website, hellosignify.com or holasignify.com, as well as checking the phone number on the back of your health insurance card to see if you are eligible for these no-cost visits.
Dr. Heidi Schwartzwald, thank you so much for joining ISS. We'll see you next time.
Thank you for having me.